Hey everyone, I'm going to be talking about case 5.1 today, which is titled, Should Doctors Talk to Relatives Without a Competent Patient's Consent? It was written by Oliver Mitten. Oliver Mitten is a medical student. He had just started clinical school, and he was taught ethics in the classroom, and he said that they put confidentiality into a very simple definition, which is as follows. Do not tell others who are not involved in patient's care information gleaned from a consultation. This is on page 298. However, when Mitten flipped over to the clinical side, he often noticed doctors talking to the patient's relatives, which was way different than what he was taught in the classroom. He decided to ask clinicians about this, and many actually acknowledged the importance of talking to the relatives. However, they also still believed that consent was important. So Mitten noticed that when the clinicians were talking to the patient's relatives, they were still choosy about what they told and to whom they talked to. So after seeing this kind of reverse ethical situation in the offices, he drew up a couple concerns. The first one was a possible decrease for patient autonomy, which he actually saw opposite results for. And he also worried about the risks versus the benefit of talking to a patient's relatives, but Mitten actually saw greater benefit in this. Mitten kind of ends this case by discussing the classroom versus clinical teachings and how different they are. Mitten came to the conclusion that ethics needs to be taught more in the clinical setting than in the classroom setting. So to start off with, I'm actually going to focus on the last part of 5.1 first, just to kind of lay the foundation for how a medical student may actually gain their ethics. In The Good Doctors by Samuel Gorovitz, he discusses the characteristics of a physician that makes them good and moral. In this, he discusses Aristotle's theory that habituation improves morality on page 36. So while students may learn in the classroom, they also learn a lot from their teachers and may often model their behavior on this, and this is actually where they tend to get most of their characteristics from. Gorovitz also later offers examples of different models through which ethics may be taught, including kind of heavy loading the front end of clinical or curriculum, or kind of end loading the curriculum with a bunch of different ethical situations all at one time. However, the superior model that he landed on was the intermittent method. In the intermittent method, students are taught throughout their whole medical schooling and throughout their clinical experiences when it was necessary or when a certain situation arises. So this is kind of similar to what Mitten experienced, that the textbook definition of what we should do ethically in certain situations doesn't necessarily follow what may be done clinically. So now there's kind of a foundation laid for how a physician may develop their morality and ethics. I'm going to discuss the questions and concerns that Mitten develops throughout his experience. Mitten's first concern was a decreased autonomy for the patient. On page 225 of The Limits of Confidentiality by Bach, she states that she believes individuals have the right to have secrets, and revealing them could leave them to feel unprotected and kind of in a dangerous situation. To follow this, the American Medical Association believes confidentiality should only be broken if someone is a threat to themselves, a third party, or the public. However, the clinicians continue to break confidentiality even if this isn't the case. And there may also be the case in which telling relatives may cause them to attempt to sway a patient. And I actually kind of saw a great example of this. So I'm an athletic training student, and one of the clinical rotations we complete is down at the Fayette Health Clinic here in town. A diabetic patient came in with, I'm assuming was maybe her brother, and this patient wanted to switch from using needles to using insulin pens, and the brother was consistently talking about how the pens were so much greater than the needles and how he had such a great experience. And the doctor kind of shut him down and explained that he wanted to hear from the patient themselves about what the patient wanted and not his experience, but he needed to know if she was going to be comfortable with these decisions. And I think that was a really good example of how it may actually harm a patient to talk to the relatives and how they may try and force them into a decision that they didn't want to make. However, Mitten came to the conclusion and saw the reverse of this, that there was actually an increase in patient autonomy. He saw the more the relatives were involved, the more the patient was willing to actually talk about possible decisions and possible choices of care. He also saw that patients, rather than just jumping into a decision, thought about things more rationally and came to more rational decisions. So according to the reasons I discussed from the limits of confidentiality, sharing information is indeed quite immoral. But if we kind of move away from that textbook confidentiality that Mitten was taught, it's apparent that there isn't really, that there is a strong reasoning to include the relatives, and it actually may improve a patient's care. So Mitten's second concern deals with the oversharing of information. Now, in Confidentiality, a comparison across professions, Armstrong discusses Beauchamp and Childress's 4 requirements for justified infringements. I'm just going to focus on 2 of the 4, which is the 3rd and 4th requirement. These are on page 247. They state that chosen infringements must match the goal, and infringements should be as minimal as possible. The way that I look at it is that as long as the confidentiality is breached, knowing that it may help the patient, then it is absolutely acceptable. Another way to look at this is through Kantian ethics, which is discussed in a brief introduction to the morality of deception. According to Kant, it is always wrong to lie. And according to this line, the patient's relatives would be revoking their freedom to possibly help the patient. Obviously, we saw that there was actually an increase in patient autonomy if the doctors were 100% truthful with the patient's relatives. So, based on this discussion, the way that I see it is that if we follow Kantian ethics, keeping information confidential from the patient's relatives is actually more immoral, as there is always an opportunity that the patient's relatives could improve the situation the patient is in. So Mitten also discussed weighing the risk versus the benefits behind talking to the patient's relatives. In a defense of unqualified medical confidentiality, words of Beauchamp and Childress are addressed again. On page 266, they urge clinicians to consider the harm that may be considered by breaching confidentiality. However, based on the real-life study that Mitten conducted, he actually saw that there was a greater benefit to talking with the patient's relatives. Ultimately, I believe this case kind of comes back to the foundation of how patients gain their ethics and their morality, based on what was discussed in the Good Doctors. So even though the American Medical Association can set these confidentiality guidelines in place, I think Mitten's evidence really shows that it really truly is hard to follow those rules and guidelines by the book, and that it is actually okay to break them, and according to the Kantian ethics, may actually be more immoral not to breach the confidentiality. Now, there are several different ways to look at this, but there were a few pertinent questions that I gathered while in the process of doing this case study. One of them was, is it unethical to keep information from relatives knowing it's possible they could help the situation? And the other one is, does one risk breaking a patient's trust in order to involve the relatives? I think these are important questions and kind of relate back to Beauchamp's and Childress's requirements, just because these are the important questions that we're asking before infringing on the patient's rights. So while I don't think there will ever be a definitive answer to whether or not breaching confidentiality is moral or immoral, I believe that Mitten's study and evidence offers strong reasoning as to why it actually can be acceptable to breach a patient's confidentiality.